Okay, so we've had enough time for the dental block to work. She's numb. We're going to start with the Juvederm injection. What I like to do is take an alcohol wipe and just basically wipe the lips. Take any lipstick or anything else off. You can't really sterilize the lips, but the alcohol does help remove any extra stuff that is sitting on the surface. Now, this is Juvederm Ultra. There's also an Ultra Plus, which is thicker. It's more similar to Perlane, which we'll be doing next. Juvederm Ultra is a clear syringe, and it's a clear hyaluronic acid gel. Okay, so we're going to start. I like to kind of keep the patient's mouth slightly open, not wide open, just slightly open. And what it does, I start penetrating the needle. And uniformly injecting. I like to inject as I'm entering to push away any small blood vessels. That decreases the chance of bleeding and bruising. It's very common to bleed and bruise from the lips. They're very vascular, but doing that technique is a little nice modification which actually lessens the chance of bleeding and bruising. So the penetration and filling is from both sides, as you enter and as I pull back. Now, as you can see, with her, she has a very nice lip roll, which means I really see her red lip nicely. This is partially because we've actually injected it before in the last few months. But with this type of lip, I don't need to inject the vermilion border, which is the border between the red and white. If I wanted to get more of a roll, I would do it slightly differently. The take-home message is every lip is different, and the injection has to be done differently. As I've said before, if you fill the lips like a sausage link, they'll look like sausage links. Open your mouth just a little bit. A lot of times patients will not have sensation or control over their lips, so they may think that the mouth is open when it's not. You just have to gently remind them. After I fill the first round, I do two things with my hands. One is I feel how much filler I have on each side. The tactile sensation definitely helps making sure we have a symmetric fill. The second thing it does, as you fill the lips, by smoothing it out, you don't have any lumps or bumps or nodules. Doing okay?
Mm-hmm.
Okay. Keep the mouth opening. We're going to go to the bottom lips. Same thing. Penetrating, filling as I penetrate, avoiding the labial artery, and also filling as I pull back. You can see with her so far, we haven't encountered any major vessels, so she hasn't had any major bleeding, which means she won't really have any major bruising so far. But we're not quite done yet. After I smooth it out, I have them hold her lip together. I take a step back to get a better look. They look very symmetric. I like to overfill it just a little bit because it loses its volume. Just two little areas that I see a slight little shadow. Filling those out, and you can see that this is a different technique. It's a perpendicular injection. Put the lips together again. Her right side is naturally a little bit less full than the left side. A little more on this side. And we're done with the lips. That took about 3/4 of a syringe of Juvederm, and we had done about a cc just a few months ago, so this is just adding up on top of that. What I like to do next is, I have this extra Juvederm, I definitely do not want to waste it, so we have injected the Naso Labial Folds in the past for her, and we're going to do the same thing here with the remainder of this. This is a fantastic injection for that purpose. What we're going to do is take a little alcohol wipe. Again, sterilize this area. You don't have to follow me.
Exactly what I wanted. Okay.
What I did is I changed the needle to a fresh needle. It's sharp, and it also doesn't have the bacteria from the lips on it. And what I do is I again penetrate straight in to the high nasal labial fold. And this technique is different than the filling technique of this method. And I use both to basically push up and volumize the tissue. Do the same thing on this side. She doesn't need it lower down. After I inject it, I massage it, smooth it out. And as I feel it right now, there's absolutely no lumpy bumpiness. And that's the beauty of Juvederm. So that concludes the injection of Juvederm Ultra to the lips and the nasal labial folds. This little bit of point bleeding will not bruise. It's very minor, and essentially holding pressure for about just 2 minutes stop stack. I'll have you hold this, Jen.
Mm-hmm.
And she's lucky that there was no blood vessels in the way for the lips. So essentially the lips are done. She shouldn't have any major bruising. She can cover it with lipstick and she'll be ready to go out tonight.